Help support our coverage with a free account on Privacy, the service that keeps your bank information private when shopping online. Take control of your subscriptions and other recurring payments, plus pause and close privacy cards at any time. And get $5 right now to try the service at collision.live/privacy.
Well, our next guest is here. Hello.
Hi there. How are you?
I'm good. How are you?
I'm doing well, thanks.
Can you please introduce yourself for us?
Sure. My name is Elliot Stone. I'm the CEO of Alavida. Alavida is a help made simple for heavy drinkers. So we're a modern alternative to rehab that takes people through sort of an online experience where they go through treatment with one-on-one with professionals, as well as like asynchronous messaging with a coach, and digital application that kind of brings it all together and makes it very easy to get into it and also stick to it and drive long-term behavior change.
Okay. And that's the important part, is driving that long-term behavior change, because so many people fix it for a short period and then something happens and
Yeah, I think it's partly. I mean, one of the biggest differences is that most people don't come to us because they want to be abstinent. They come because they want to be more in control and they want to drink less, which is a huge segment of the population of drinkers. And most people who go into traditional rehab are usually doing so after a major crisis, because the social costs and the financial costs of getting into rehab are quite high. Yeah. So most people don't consider that until it's really bad, right? So the personal costs are really high as well. And so our goal with starting Alavida was really to bring that barrier down, get people earlier, and drive a long-term sort of healthier relationship with alcohol.
Gotcha. So where did this come from?
Well, for me, I kind of made it in middle management in a large multinational, and sort of successful in my 30 years old, and got really, really burnt out. And went back to school and wanted to do work that mattered. And I spent sort of 3-4 years like starting companies that were sort of following on other people's ideas, sort of failing several times. And I read an article, a really well-written article in The Atlantic in 2015. It was pretty tough on AA, but they really dug at all the problems with traditional rehab and sort of some of the solutions that were out there. And I kind of went through that as a playbook for like 3 months and basically talked to everybody associated with the article. And then I strung together a team that were really passionate about the same kind of change. And sort of fast forward 3 years, here we are. But the original thesis really came from a Finnish model that was really combining sort of CBT and pharmacotherapy, so use of medication, and in a lighter and longer approach, as opposed to sort of 28-day rehab, which we're really familiar with here, so the Minnesota model. They were doing it over a longer period and really gearing people at whatever the goal that they wanted to gear towards, which most times was low risk drinking.
Okay.
And for us, we just layered on tech and really empowered it and tried to make it something that's scalable and really increase access. Because here in Canada, it's a big thing to have it out in rural areas where there's literally no other options. And where an AA meeting is not anonymous because there's only 20 people in your community or however small it might be. So AA is a wonderful organization, but it's kind of one piece of what people need. Peer support is very important, but there's other components as well that can be very helpful, and we sort of string those together in a personalized package that helps people get where they want to go.
Okay.
Gotcha.
Where does a lot of your content come from, and how does it differ from alternative resources?
Content, you mean like the educational content that we're pushing? So, so we have relationships with lots of clinicians. We have a team of doctors and therapists that work with us, and a lot of partners and advisors that have helped us collect that. But I think there's a lot of really good groups out there. We don't have to create it all in house. This is a message that's sort of. It's funny that it's not mainstream, but it's loud. If you sort of look behind the curtain, there's a lot of people who've been working at this. I'm standing on the shoulders of giants. Like I'm at this 3-4 years, but there's people that have been doing this kind of research and really proving this point for decades. And it's really just going back to some of the writers there that are really influential. The lady who wrote that article, her name was Gabrielle Glazier. Another lady, Maya Spalovitz, who's very influential as well. But then we produce some in-house as well. I mean, we have a marketing team. And really what we've been trying to do is build a brand that's relatable and approachable, and that doesn't make people feel, I don't know, so it's like to take a sort of an analogous situation, we're becoming very quickly more comfortable with talking about pot in Canada, right? Sort of by virtue of the fact that it's in front of everybody now, right? It's legal, it's here. And so it's normalizing as a conversation. And I don't think we have that normalization around talking about alcohol problems because it's very normalized to drink. But the moment you need help, it can be very, very stigmatizing.
Yeah.
And so it's like bringing that out.
It's hard to talk about it.
What's wrong with you?
Yeah. Which is weird because the stigma around drinking is less like, if you take somebody who's, say, out on a Friday night and has a little bit too much to drink and says something a bit, awkward to somebody and they feel a bit weird, like that's not as stigmatizing as, say, somebody who shows up on Friday night and is like, no, I quit drinking for the rest of my life. You know what I mean? Like, just think about that sort of. Yeah. It's like, wow, what happened to that person?
To you?
Yeah. And I don't think that that's fair because actually that's the healthiest thing that a person could do for themselves.
Right. Is say, I have a problem and I'm backing away from the problem.
Yeah.
And yet it's looked at as like some crazy.
Yeah, you might as well have leprosy. Right. And I think that our goal was to really construct a program that somebody could get into without having to tell anybody else about and sort of naturally pare down their drinking. So to their friends, it just looks like, hey, like he's looking really healthy these days, or she's looking great.
Yeah.
And, little by little, they're drinking less, but it's not sort of a bang one day to the next.
Yeah, like right in your face.
Because that can be very hard on social circles and work settings. A lot of times people are drinking for work, right? Like lawyers, doctors, a lot of people drink to unwind. And it's very difficult to sort of make a break. And also it becomes this behavior you were talking about in terms of sort of binging and abstinence is one of the most dangerous behaviors you can have for your own personal health and also for others as a public safety situation, because that's when if you're blackout drunk, like that's when really bad accidents happen, car accidents happen.
Right.
And that comes from, periods of long abstinence followed by extreme binges can be some of the most dangerous health behaviors for us. So it's like really bringing the harms down associated with binge drinking, and you can take down the costs a lot on society.
And that cold turkey, just I'm going to stop now, can also be harmful personally because your body can go into shock if you've been a long-term heavy drinker.
And we evaluate that, like, because there's that's a particular, like, in severe cases, where you may be at risk for seizures and things like that. That's not something that, like, we would refer those people to the emergency room or to another facility for detox, because some people absolutely need that. We don't make claims to that extent.
Right.
But to the extent that you're able to pare it down over time, it can be very healthy.
Yeah, that process is way easier.
Well,
I
guess to the extent it works for you, right? Like that's the important thing here is that, like, if you're drinking a bottle of whiskey a day for 20 years and all of a sudden you just have an epiphany and wake up tomorrow and you don't drink ever again, like great. Like, that is wonderful, and you should be supported by everyone around you.
Absolutely.
But if that's not working for you, like there should be options offered to people at different stages.
Right.
So I'm assuming that your program is strictly for alcohol abuse, not just substance abuse?
Yeah, well, so we focus on alcohol use disorder. So it's when it's the leading indicator. So it's very rare that it's all by itself. Cocaine is common with it, cannabis use, and those can be of varying degrees. And what we look for as we're assessing someone on their way into programming is whether or not alcohol is the leading indication. So if it's a difference between someone, if you just think about it in common sort of terms, it's a difference between someone who, has a little bit too much to drink on the weekend and does some cocaine versus someone who does cocaine every day and then drinks a little bit to come down. Mm-hmm. And again, these are like sort of just basic ways of thinking about it, but that's sort of part of the mindset of the way we gear at it. So alcohol is the largest in terms of costs on society, and other indications can be dealt with through dealing with that first.
Okay.
But we don't treat opioid addiction, and those, like, there's some clear boundaries around certain things.
Gotcha.
How long does your program normally last? Like, what is, like, the duration for the average person?
Yeah, so we usually stay with people between 6 to 12 months.
Okay.
So it kind of goes through phases, right? Mm-hmm. Like we're gearing someone up, getting to know them, personalizing a package for them. But again, this is lighter. Most people are staying at work. Their social life doesn't really change that much. They're having periodic visits. They're checking in with us on a daily basis. They're maybe taking medication. And it kind of gears up to a level of intensity that's fit for them. And then over time, we're switching the reins and sort of giving them control again, and it becomes more self-guided in the back half of the program, where really we want to set them up for, we don't want them to be dependent on us.
Yeah.
And ultimately, when they're leaving us, we want them to understand how to come back to us if they need us.
Okay.
And sort of take the anxiety out of that. So we're not like, you don't pay for a program with us and then, 2 years later you need to go through it again and you start all over at the beginning. It's, we have alumni and aftercare programs that just allow people to
check in.
Yeah, allow people to re-engage without having a significant binge, right? Like we want to take the anxiety out of those situations.
Gotcha.
And that's what the real practical sort of cognitive behavioral piece is about, right?
Definitely.
So no 12 months and you're done. It's over.
Yeah. Rinse, repeat. I mean, I think that the statistics on traditional rehab are interesting in a sense of one of them is 90-day readmission rate, and these can be quite high. Which is, if you think about that, that's people who just spent often tens of thousands of dollars went through effectively hospitalization for a significant period of time, and then may or may not be back in the next 90 days. Mm-hmm. And again, these are very serious cases, and I'm not sort of pointing fingers, but it's we need to have a real conversation about some of these things.
It's not working as well as you hope.
Yeah.
Yeah, and put other options on the table, and I think particularly options earlier for people, right?
Yeah.
It's such a common thing that there's even references to it in television. There's an episode of The Office where they find the brother passed out drunk. He's like, I just wanted to get the first relapse out of the way.
I haven't seen that one, but it's funny being in this because coming in from outside of healthcare and then now working in it for 3 years, my awareness is let's say acute because we talk about this every day.
Sure.
But the way that I watch movies and see how much alcohol itself permeates our culture, let alone the sort of the humor around cases which probably need to be addressed. Which are still funny. I think it's okay to still laugh, right?
Yeah.
But it's interesting how pervasive it is in culture, and how we're not really having the conversation about treatment that we should. And I think one of the reasons why this journey for us has been a bit interesting, in that there's only a couple other companies that have really even come into this space, even though it's just a huge problem. It's because the opioid crisis is going on, and we have cannabis legalization, and sort of there's a lot of media time spent on that, whereas alcohol is still just the very, very big elephant in the room.
Yeah.
That's really not getting addressed. And it's a global problem as well, right? Alcohol doesn't really discriminate, save for a few Arab countries where it's illegal.
Right. Right.
It's a really prominent thing worldwide.
It's been around basically as long as people.
It is one of the oldest public health problems, I think, in existence.
There are elephants in Africa that knock apples out of trees and bury them so they will ferment, and they can get drunk eating the fermented apples.
It's not just it's monkeys. There's a whole bunch of species that do that.
Bees.
It's pretty funny.
Bees do it.
So so it's literally been around as long as life, and yet somehow it's like this thing that we pretend doesn't really.
Yeah, you have to hide it.
Well, and you asked how I got into this, and part of the thinking for me was I wanted to do something that I would be interested in.
Yeah.
That was going to, because starting a company is a long haul, and you really need to do something that you want to be doing 5-10 years from now. Mm-hmm. And for me, I've always been interested in sort of substance use and drug culture. And especially over time and across, I've lived in 5 different countries, and how it's treated in different areas, and sort of what's normal and what's not, and what's good and what's bad, according to different cultures, and I think it's just absolutely fascinating that here we are, and we're not having this conversation just yet.
Well, how far along in this process are you?
So how far as a company?
Yeah.
We founded the company in 2016, so we're about 3 years in.
Okay.
We're in 6 Canadian provinces. We're in California with a sort of small office, and we've just started to see. So we started serving the public because, unlike a lot of areas of healthcare, there is actually an addressable group of people. Because addiction care, sort of fortunately or unfortunately, has been on the outside of healthcare for a while, both in the U.S. and Canada. Mm-hmm. And so there are people who pay for it outside of plans. And oftentimes it's not covered under plans. Mm-hmm. So we started by selling to individuals who could afford treatment, and we've done that for over 400 people. And now we've actually started to get some relationships with large employers as well. And some of those employers are actually giving us relationships with major insurance payers. So it's sort of this thesis in healthcare that you got to start by solving the problem, and then you got to solve the problem within the broken system. Depending on how broken the system is, what province, community, or state you're in. But the innovation in healthcare tends to be a lot around commercialization and sort of how to break into this really beast of a system that we're all frustrated with sometimes.
Yeah, definitely.
If people want to find out more about your service and follow your journey, how can they do that?
So for us, they can visit our website at alavida.co, so alavida.co. And there's sort of self-assessments on there if anybody's worried about another person or would like to take the assessment themselves. And that's the easiest way. Like, most people fill out a form and we give them a call back. And if they want to follow the company, Think Alavida is our Twitter tag.
Okay.
And I'm really bad at Twitter, but my team is wonderful. So
that's good.
And we're on Facebook. We spend a lot of time on Facebook, sort of making sure that we address all the questions that people have. And so there's a lot of content there that's built up over time of people asking really tough questions and us sort of doing our best to really make sure that those things get answered.
For sure. I'm right there with you.
Yeah, definitely.
I have these two for social media stuff because I forget that it exists most of the time.
I've turned all notifications off on my phone. I have to have some peace. And I also have a 9-month-old, so it's like...
Oh, some peace would be good.
Yeah.
So I was going to say, so it's lacking anyway.
Yeah.
Is what you're saying.
Yeah, exactly.
Okay. Well, hopefully Collision, the rest of the day will be good for you.
Yep.
Yeah. No, it's been fun. And thanks for the opportunity, guys. It's very nice to meet you.
Yeah, thank you so much for coming on the show.
Okay.
Have a good one.
Thanks.